Hello and welcome to NEET Prep Go. So in the last lecture we had done till saponification in chemistry in everyday life. So without any further ado, let's get started. Let's revise. So from living perception to abstract thought and from this to practice, this was given by V.I. Lenin. Now, what are drugs? Drugs are chemicals of low molecular mass, that is 100 to 500 U. Then low molecular masses. Then they interact with macromolecular targets and they basically produce a biological response, and if this biological response is therapeutic and useful to us, then these chemicals are called as medicines. And these medicines are used in diagnosis, prevention and treatment of diseases. Most of the drugs which are used as medicines, if we take them in larger amounts, then they are poisons basically. So use of chemicals for therapeutic effect is called as chemotherapy. So drugs are chemicals of low molecular masses, that is 100 to 500 U, and they interact with macromolecular targets and they basically produce a biological response. And if this biological response is therapeutic and useful, then they are called as medicines, and they become potential poisons if taken in larger amounts than recommended. And the use of chemicals for therapeutic effect is called as chemotherapy. Now drugs can be classified on, that is, 4 bases. That is, firstly, on the basis of pharmacological effect, that is how the doctors, that is useful for doctors because it provides them whole range of drugs for treatment of particular type of problems, such as analgesics. They help in killing the pain, that is painkillers. Then antiseptics, killing or arresting the growth of microorganisms. Now on the basis of drug action, that is all antihistamines, they inhibit the action of the compound histamine, which causes inflammation in the body. So all antihistamines, they inhibit the action of compound histamine. So basically, on the basis of drug action, that is histamines, where histamine get blocked. That is, histamine is responsible for causing inflammation, and antihistamine basically inhibit the action of histamine. So they can be used as on the basis of drug action. They can be classified. Then on the basis of structure, sulfonamides, they are a common structural family. So they can be classified in the way they share common structural features, because in that case, if they have most of the times when they have common structural features, then they will also be having similar pharmacological effects when used. And also on the basis of molecular targets, basically they interact with molecules such as carbohydrate, lipid, protein, nucleic acid, and all of these are called as target molecules or drug targets, and they have common structural features, may have same mechanism. So the classification based on molecular target is most useful for medicinal chemists. So the 4 ways on which the drugs are classified. So first is pharmacological effect, that is the doctors use it for treatment, prevention and all, specifically for specific reasons, such as analgesic, for painkiller, antiseptic to kill microbes and arrest them, the growth of their EA. On the basis of drug action, that is how the antihistamines, they inhibit the reaction which is done by histamine, which is produce inflammation in our body. Similarly, on the basis of chemical structure, that is sulfonamide, that is a common structure, having common structure, that is they may also be having common pharmacological effect. And lastly, that is molecular target. So that is the drug targets or molecular target molecules are carbohydrate, lipid, protein, nucleic acid. So if they have common structure, they may also have common mechanism on targets, and basically the classification of molecular target is the most useful classification for medical chemists. Now drug target interaction, that is proteins which perform the role of biocatalysts, are called as, in our body, are called as enzymes, and those which are crucial for communication system in the body are called as receptors. What are carrier proteins? They carry polar molecules. Polar molecules, that is your hydrophilic molecules across the cell membrane. Nucleic acid coded genetic information for the cell, and lipids and carbohydrates are structural part of the cell membrane. So the first function of an enzyme is to hold the substrate for a chemical reaction. Active sites of enzyme hold substrate molecule in the suitable position. Okay, so what are the two major functions of enzyme? That is to hold the substrate, that is an active. So enzymes have an active site. So in that active site, the substrate should be held in a suitable position so that it can be acted by the reagent effectively. And how does it bind? That is, it can be binded to the substrate can bind to the active site of the enzyme with the help of ionic bonding or van der Waals forces or dipole interaction or ionic bonding. Then after that, what is the second function? It is to provide functional group which will attack the substrate and carry out the chemical reaction. Then drug enzyme interaction, that is competitive and non-competitive inhibitors are there. So basically what do drugs do? That is the drugs block the binding site of the enzyme and prevent the binding of the substrate. So they can inhibit the catalytic activity of the, or they inhibit the catalytic activity of the enzyme. So such drugs are called as enzyme inhibitors. So there are enzyme inhibitors, they inhibit the action of the substrate in two ways. That is, firstly through competitive inhibition, secondly through non-competitive inhibition. Firstly, how do they do it? By competitive inhibition, that is they compete with the substrate, and with the one which is in more concentration or more suitable or has more affinity to bind with the active site of the enzyme, that binds. And if it is a drug, then that is drug inhibitor, then basically the chemical action has been inhibited. And if it is a substrate, then it is going to proceed. So that's how competitive inhibition takes place. But some drugs, they do not bind to the enzyme's active site. They are like, why should we compete so much? So that's why they bind to a different site in the enzyme, which is called as the allosteric site. The moment they bind to the allosteric site, they change the shape of the active site. Once the shape of the active site is changed, and neither the substrate nor drug, nothing can basically now get attached to the active site or even recognize it. So therefore, if the bond formed between an enzyme and an inhibitor is a strong covalent bond, so if this inhibitor which has occupied the allosteric site, if the bond between them is a very strong covalent bond and cannot be broken easily, then the enzyme is blocked permanently. In this case, the body then degrades the inhibitor complex, that is the enzyme inhibitor complex, and then synthesizes a new enzyme. Now receptors are as drug targets. What are receptors? That is, they are crucial for the body's communication. So basically they are embedded in our lipid bilayer, that is in our cell membrane, and so they have two sides, right? So in one side, the small active site is there, and that active site is towards the outside of the cell membrane. So so basically the molecule binds to the active site of the receptor, which is pointing or is opening towards the outside of the cell membrane, and then it transports it, basically like it rotates, gets rotated, and opens into the inside. So sorry, it does not rotate, it basically sends message. Rotators and transport and plants and stationary. So basically it binds and then it sends the message. So receptors are proteins that are crucial to body's communication process. Majority of these are embedded in the cell membrane. Receptor proteins are embedded in the in cell membranes. Majority of these are embedded in cell membranes. Receptor proteins are embedded in the cell membrane in such a way that the small part which possesses the active site, it projects out of the surface of the membrane and it opens on the outside region of the cell membrane. So see here, it is opening to the outside of the cell membrane. And in the body, message between two neurons and that between neurons to muscles is communicated through certain chemicals. So these chemicals are known as chemical messengers, and they are received at the binding site of the receptor protein. So at neuromuscular junction, we have acetylcholine, which is chemical messenger. So these chemical messengers, they bind to the active site of the receptor, and basically to accommodate it, the shape of the receptor also changes. So the shape of the receptor changes according to the chemical messenger, which is going to come and get attached. So therefore the chemical messenger gets attached, and then the message is sent into the cell, and then the chemical messenger gets detached, and the receptor regains its shape. And in this case, there are a large different number of receptors, a large number of different receptors in the body, and they interact with different chemical messengers. They show selectivity for one chemical messenger over the other. Why? Because their binding sites have different shape, structure, and amino acid composition. Now, agonist or synergistic effect, and antagonistic or opposite. So when a drug binds to the receptor and inhibits its natural function. So basically, if a drug has binded to the receptor site and inhibits the natural function, that is, if some function is about to take place and the drug binded to the receptor and sent a message to inhibit it, then those drugs are called as antagonist. And they are useful when blocking the message that is required. But if there are other types of drugs which mimic the natural messenger by switching on the receptor, that is, when that chemical messenger binds to the receptor, then the receptor sends a message to, that is, it turns on and the function is carried out. So then they are called as agonist or synergist. So these are useful when there is a lack of natural chemical messenger. Now, therapeutic action of drug, firstly antacid. So if there is overproduction of acid, then it causes irritation and pain, and in severe cases the mucosal layer of our stomach, it can get degraded and stomach ulcers can be formed. Until 1970 there was only one treatment for acidity, that was administration of antacids such as sodium hydrogen carbonate or a mix of aluminium and magnesium hydroxide. Why? Because these all are basic. So basically they can lessen the acidity of the stomach, that is the pH of the stomach. So sorry, they can increase the pH of the stomach. So however, if we consume excessive hydrogen carbonate, then the stomach pH is 1.8. So if we consume excessive hydrogen carbonate, then the stomach pH will increase and it will become alkaline. And the moment it becomes alkaline, since the pH of the stomach should always remain highly acidic, therefore this triggers the oxyntic or parietal cells, and even more acid, that is, it triggers to produce even more acid. So metal hydroxides are better alternatives because metal hydroxides are insoluble, so they don't increase the pH above neutrality. So therefore, for this reason, instead of consuming hydrogen carbonates, we should always consume metal hydroxides, which are better alternatives. Why? Because metal hydroxides are insoluble, and they do not increase the pH above neutrality. They only control the symptoms and not the cause. Therefore, with metal salts, the patients cannot be treated easily. In advanced stages, ulcers become life-threatening, and the only treatment is the removal of the affected part of the stomach. So therefore, a major breakthrough in the treatment of hyperacidity came with the discovery of a chemical which was histamine. So basically, it was realized that histamine basically stimulates the secretion of pepsin and hydrochloric acid in the stomach, and the drug cimetidine, which is Tegamet, was designed to prevent the interactions of histamine with the receptors which are present in the stomach wall. So basically, whenever we know that when we are left without, when we don't eat food for a long time, then we develop acidity, that is, the pH of our stomach is 1.8 due to the presence of hydrochloric acid, which is secreted by parietal or oxyntic cells. So because of very high amounts of acid and very low pH, that is the mucosal layer, that is the one that protects our inner lining of stomach, that slowly keeps getting depleted, and the moment that is, it becomes very thin, and that is the acid touches the inner lining of the stomach, then ulcers are formed, and they are very painful and they can be deadly. So until 1970, there was only one treatment for acidity, which was the consumption of antacid, and those antacid were either sodium hydrogen carbonate or aluminium or magnesium hydroxides, mixture of aluminium and magnesium hydroxide. Sorry. So, but later on, it was realized that if we consume too much hydrogen carbonate or bicarbonate, then it will turn our stomach pH alkaline, and the moment our stomach pH turns alkaline, our body requires a balance, and since always it is acidic, it has acidic pH in stomach, it will cause the oxyntic or parietal cells to secrete even more acid, and because of secretion of even more so basically it is going to counter effect it, like instead of treating it, if we make the stomach alkaline, then even more acid will be released. So therefore, because of this reason, metal hydroxides are given. Why? Because if we consume metal hydroxide, then since metal hydroxides are insoluble, they are not going to increase the pH beyond neutrality, and they will only control symptom, not the cause. So therefore, with these metal salts, patients cannot be treated easily. In advanced stage, ulcers become life-threatening, and only treatment is to remove that part of stomach which contains the ulcer. So therefore, a major breakthrough was required and much needed in the treatment of hyperacidity, and it came with the that is, it came through discovery according to which a chemical, that is histamine, which we know is a vasodilator, as well as causes inflammation in our body, that is allergic symptoms and all. It basically used to stimulate uh, that is the secretion of pepsin as well as hydrochloric acid in the stomach, and therefore the drug cimetidine or Tegamet was designed to prevent the interaction of histamine with the receptors which are present in the stomach wall, and therefore because of this cimetidine or Tegamet medicine, that is, since the histamine could no longer react or stimulate the receptors which were present on the stomach wall, therefore the release of acid became lesser, and the importance of drug was so much that it remained the largest selling drug in the world until another drug, that is ranitidine or Zantac, was discovered for hyperacidity. So now histamine is a potent vasodilator, that is, it dilates the blood vessels, but it contracts the smooth muscles in the bronchi and gut, but it relaxes other muscles such as those in the walls of fine blood vessels. So vasodilator dilates blood vessels. It dilates the walls of fine blood vessels, but which muscles does it contract? It contracts the smooth muscles which are present in the bronchi and in the gut. It is also responsible for nasal congestion associated with common cold and allergic response to pollen. So, for causing inflammation and allergic response in the body, as well as for nasal congestion, as well as for dilation of blood vessels and constriction of smooth muscles in bronchi and in the gut, histamine is responsible. Now, synthetic drugs, that is bromophenyramine, which is also called as dimetap, and terfenadine, which is called as Seldane. Seldane and dimetap, they were both synthetic antihistamines. Which were the synthetic antihistamines? Bromophenyramine, which is called as dimetap, and Seldane, which is terfenadine. They interfere with natural action of histamine, that is, they show competitive inhibition, that is, they compete with histamine to bind with the sites of the receptor, and where histamine exerts its effect. Now, tranquilizers. Tranquilizers and analgesics are neurologically active drugs. They are neurologically active drugs. They affect the message transfer mechanism from nerve to receptor. What are tranquilizers? They are a class of chemical compounds used for the treatment of stress, mild to severe mental diseases, depression, anxiety, irritability, excitement, all of those. And they induce a sense of well-being. So they are the essential component of sleeping pills. Then There are different types of tranquilizers. For example, firstly, noradrenaline. Noradrenaline is one of the neurotransmitter, and what is its function? It helps in that is, it plays a role in mood changes. If the level of noradrenaline is low for some reason, then signal sending activity becomes low and the person suffers from depression. So what do basically tranquilizers do? That is, they function by different mechanisms. So noradrenaline is one of the neurotransmitters, and if noradrenaline in a person is low, then the person will have depression, mood swing, and it will be sad and all those things. Why? Because noradrenaline is low, so therefore signal sending activity is also low. So in such cases, antidepressants are required. What do antidepressants do? They inhibit the enzyme which catalyze the degradation of noradrenaline. So basically, noradrenaline is becoming low because due to some genetic factors or whatever. So because of that, noradrenaline is becoming low. So the reason or the enzyme which is causing noradrenaline to become less and less, or is degrading it, that enzyme is inhibited, and because of this, the neurotransmitter is slowly metabolized and it can activate its receptor for longer periods of time, thus counteracting the effect of depression. What are the two tranquilizers, that is, which antidepressants? They are phenelzine and iproniazid. Iproniazid. Iproniazid and phenelzine. Some tranquilizers, namely chlordiazepoxide and mefloramate, are relatively mild tranquilizers to relieve tension. What are the two tranquilizers which are used to relieve tension? Chlordiazepoxide and mefloramate. What is Equanil? Equanil is used to control depression and hypertension. So two antidepressants are iproniazid and phenelzine. Equanil is a tranquilizer to treat depression and hypertension, and chlorodiazepoxide and mefloramate and chlorodiazepoxide, they both are mild tranquilizers which are used to treat tension. Then derivatives of barbituric acid are called as barbiturates. They are all veronal, amital, seconal, nembutal, luminal. They are all an important class of tranquilizers, that is barbiturates. They are hypnotic, that is, they are basically sleep producing agents. Some other substances used as tranquilizers are Valium and serotonin. So what barbiturates are hypnotic or sleep inducing agents, and their example are veronal, amital, nembutal, luminal and seconal. Other substances used as tranquilizers are Valium and serotonin. Now analgesics. Analgesics are basically painkillers. They abolish pain without causing impairment of consciousness, mental confusion, or incoordination or paralysis or any other things in the nervous system. That is what they do. They only focus on the pain receptors, and they abolish pain or they reduce pain. So there are two kinds of analgesics. First are non-narcotic analgesics, and second are narcotic analgesics. Non-narcotic analgesics means non-addictive analgesics or drugs. For example, paracetamol, aspirin, etc. Then narcotic drugs are addictive drugs. For example, morphine, heroin, codeine, etc. So firstly, non-narcotic or non-addictive analgesics are aspirin and paracetamol. Aspirin is the most familiar example. What does aspirin do? Aspirin inhibits the synthesis of chemicals which are known as prostaglandins. What do prostaglandins do? Prostaglandins basically cause muscular contractions, inflammation in the tissue, and they cause pain. So aspirin inhibits the synthesis of chemicals which are known as prostaglandin, and they are also effective in relieving skeletal pain in the case of arthritis. Now, some of these drugs are also effective in many other effects, such as reducing fever. What is it called? It is called as antipyretic. So analgesic is reducing pain, and reducing fever is antipyretic, that is reducing body or increasing body temperature, and preventing platelet coagulation. That is also, they are anticoagulants. Since They are anticoagulants. They also reduce the risk of heart attack or prevention of heart attack. Example is aspirin, paracetamol. Aspirin and paracetamol. Narcotic analgesics, those which are addictive analgesics, example is morphine and many of its homologue. When administered in medicinal doses, it relieves pain and produces sleep. In poisonous doses, it can lead to stupor, coma, convulsions, and ultimately death. Morphine narcotic are sometimes referred to as opiates. Why? Because they come from the opioid plant, which is the poppy plant. Then these analgesics are chiefly used in the relief of post-operative pain, that is after a major or serious operation, then cardiac pain, and in terminal cancer patients, and also in the at the time of childbirth. Then antimicrobials. Diseases in human beings and animals may be caused by a variety of microorganisms. An antimicrobial, it basically destroys and prevents the development of or inhibits the pathogenic action of microbes. So antibiotics, that is for to inhibit microbes that is in the body, that is we can ingest them or we have to ingest them. For example, bacteria, antibacterial drugs, and virus, antiviral drugs, then fungus, antifungal treatment or agents. Then antiseptic, that is we put it on our skin. We don't exactly ingest it, but we for cleaning wounds and that is while removing stitches or external use. And disinfectants are basically put on inanimate objects. They are not put on human beings. So antibiotics are used to treat infections. Why? Because of their low toxicity for humans and animals. Initially, antibiotics were classified as chemical substance produced by microorganisms which inhibit the growth or destroy. But then later on, we developed synthetic antibiotics, and then the definition changed. So therefore, now the antibiotic refers to a substance which is produced wholly or partly by chemical synthesis, which is low in concentration, and it inhibits the growth or destroys microorganisms. How? By intervening in their metabolic processes. So basically, in the case of bacteria, that is, it will prevent its cell wall, that is peptidoglycan formation. That is, for example, there is cross linkage present in peptidoglycan cell wall. So this cross linkage, it can be inhibited by the antibiotic penicillin. So similarly, the search for chemicals that would adversely affect invading bacteria and hosts began in the 19th century. Paul Ehrlich was a German bacteriologist. He conceived this data. He investigated arsenic-based structures in order to produce less toxic substances for the treatment of syphilis. So Paul Ehrlich was a German bacteriologist, and he conceived this idea, and he investigated arsenic-based structure in order to produce less toxic substances for the treatment of syphilis. He developed the medicine arcephenamine, also known as arcephenamine or sulversan, which contained arsenic and got Nobel Prize. It was first effective treatment discovered for syphilis, and although sulversan is toxic to human beings, its effect on bacteria is even more severe than us. Therefore, that is spirochete was the bacteria which caused syphilis, and therefore at the same time when Ehrlich was working on azo dyes, he noticed that the structure of azo dye and that of sulversan or arcephenamine was similar. That is the arsenic linkage present in the arcephenamine. It resembled the nitrogen linkage present in azo dye, in the sense that arsenic atom is present in place of nitrogen. He also noted tissues which getting colored by dye selectively. Therefore, Ehrlich began to search for compounds which resemble the structure to azo dye and selectively bind to bacteria. In 1932, he finally succeeded in preparing the first effective antibacterial agent, which was called as Prontosil, which resembled the structure of arcephenamine or sulversan. Soon it was discovered that in the body, the Prontosil got converted into sulfenamide, and therefore sulfenamide was the actual real compound, and this is how the sulfa drugs were discovered. They are a large number of a range of sulfonamide analog, or one of the most effective is sulfapyridine. Arcephenamine or sulversan was the first arsenic-based drug to treat syphilis. It resembled, that is the arsenic-arsenic bond resembled the nitrogen-nitrogen bond and of azodie. And then later on in 1932, Prontosil was discovered, which was the first antibacterial agent. In 1908, sulversan was discovered. Okay, sulversan or arcephenamine. Then Prontosil, it was later discovered that prontosil inside our body became sulfonamide, and sulfonamide was the actual real active compound, and therefore this is how sulfa drugs were discovered. And one of the most effective sulfa drug is sulfapyridine. The real revolution in antibacterial therapy began with the discovery of penicillin by Alexander Fleming in 1929. Isolation and purification of active compound to accumulate sufficient material for clinical trials took 13 years. So in 1929, penicillin was discovered by Alexander Fleming, and then it took 13 years for clinical trial and everything. Antibiotics have two kinds of, either a cidal effect, that is the killing effect, it will immediately kill the a microbe, or it can have a static effect, that is an inhibitory effect, so it will just inhibit. So so in that case there were two drugs, that is bactericidal drugs and bacteriostatic drugs. So bactericidal drugs was penicillin, which killed bacteria immediately, aminoglycosides and ofloxacin. Then bacteriostatic was erythromycin, tetracycline, and chloramphenicol. So penicillin, aminoglycoside, and ofloxacin. These three are bactericidal, whereas erythromycin, tetracycline, and chloramphenicol are bacteriostatic. The range of bacteria or other organisms which are affected by a certain antibiotic is expressed as its spectrum of action. Antibiotics which kill or inhibit a wide range of gram-positive, gram-negative bacteria are said to be broad-spectrum antibiotics. So the antibiotics which kill or inhibit a wide range of gram-positive, gram-negative or gram-negative bacteria are called as broad-spectrum antibiotics, and they mainly those which affect a single gram positive or gram negative bacteria, that is against a single organism or disease, then they are referred to as limited spectrum antibiotic or narrow spectrum antibiotics. So, if effective against a single organism or disease, they are referred to as limited spectrum antibiotics. Now, penicillin G has a narrow spectrum. Now, penicillin G is narrow spectrum. Penicillin G is narrow spectrum, but ampicillin and amoxicillin, they are synthetic modification of penicillin, and they are broad spectrum antibiotics. Okay, so those antibiotics which inhibit or kill gram positive plus gram negative bacteria, gram positive plus gram negative bacteria, that too wide range, they are called as broad spectrum antibiotics. And those antibiotics which either kill gram positive or gram negative, that is either one only, then they are called as narrow spectrum. And if in this also, in narrow spectrum also, that antibiotic is used only for a particular, only for one particular disease or pathogen, then it is called as limited spectrum antibiotic. Limited spectrum antibiotic. So penicillin is a narrow spectrum antibiotic, whereas ampicillin and amoxicillin, which are synthetic derivatives of penicillin, they are broad spectrum antibiotic. It is absolutely essential to test the patient for sensitivity or allergy to penicillin before its administration. The penicillin manufactured in India is manufactured at Hindustan Antibiotics in Pimpri and in private sector industry. Chloramphenicol was isolated in 1947 and it is also a broad spectrum antibiotic. It's rapidly absorbed in the gastrointestinal tract and hence given orally in the case of typhoid, which is by Salmonella typhi, dysentery, acute fever, certain form of urinary infections, meningitis, that is swelling of the brain, and pneumonia. Streptococcus pneumoniae and Haemophilus influenza. Vancomycin and ofloxacin. Ofloxacin and vancomycin are two other important broad-spectrum antibiotics. Antibiotic dizidazirin is supposed to be toxic towards certain strains of cancer cells. So broad-spectrum antibiotics are amoxicillin, ampicillin, which are synthetic derivatives of penicillin, then vancomycin and ofloxacin, and chloramphenicol, which is used rapidly absorbed from gastrointestinal tract and given orally for typhoid, dysentery, fevers, urinary infection, meningitis, and pneumonia. Dizidazirin is supposed to be toxic towards certain strains of cancer cell. Antiseptic and disinfectant. Antiseptic and disinfectant are the chemicals which kill or prevent the growth of microorganisms. Antiseptic are applied to living tissues such as wound, cut, ulcer, and diseased skin surface. Example is furacin and soframycin. Furacin and soframycin. And they are not ingested like antibiotics. They are commonly used as antiseptic. For example, Dettol is a mixture of chloroxinol and terpineol. So antiseptics are applied to living tissues such as wound, cuts, ulcers, and diseased skin surfaces. What are the example of antiseptic? That is furacin and soframycin. They are not ingested like antibiotics. Now, commonly used antiseptic are Dettol. Dettol is a mixture of chloroxinol and terpineol. Dettol is a mixture of chloroxinol and terpineol. So antiseptics are basically put on wounds, cuts, ulcers, and diseased skin surfaces. Example is furacin and soframycin, and they are not ingested like antibiotics. Antiseptics are just applied on the surface of living tissue, and furacin and soframycin and Dettol is a antiseptic, and it is a mixture of chloroxinol and terpineol. Bithionol is another antiseptic. It is also called as bithionol or bithionol. It is added to soap to impart antiseptic properties. Then iodine is also another very powerful antiseptic. 2-3% of iodine in alcohol is called as tincture of iodine. Alcohol water mixture is called as tincture of iodine, and it is applied on wounds. Then iodoform is also used as an antiseptic for wound. Then boric acid in dilute aqueous solution is used as a weak antiseptic for eyes. Disinfectant have a higher concentration or percentage of chemicals, and therefore they cannot be applied on living tissues, and they cannot be ingested either. They are basically applied on the surface of inanimate objects, for example floors, drainage system, instrument, etc. Same substances can act as antiseptic as well as disinfectant by varying the concentration. For example, 0.2% phenol can act as an antiseptic, while 1% phenol will act as a disinfectant. Fluorine in the concentration of 0.2 to 0.4 ppm, that is parts per million in aqueous solution, and sulfur dioxide in very low concentration can be used as disinfectant. Anti-fertility drugs, that is Combination of estrogen progesterone pills which stop ovulation or suppress ovulation. They are anti-fertility drugs. Anti-fertility synthetic progesterone derivatives are more potent than progesterone. So example of synthetic progesterone derivative is norethindrone, and it is most widely used anti-fertility drug. Estrogen derivative used in the combination with progesterone is called as ethinyl estradiol, also called as novestrol. Ethinyl estradiol. Then chemicals in food, that is chemicals are added in food to preserve them, to enhance them, their appeal, and to add nutritive value to them. So examples are food color, flavor and sweetener, fat emulsifier or stabilizing agent, then flour improvers, that is anti-staling agent that bleaches, then antioxidant, preservative and nutrition supplements such as mineral with vitamins and amino acid. That is the only nutritive value in this is the nutrition supplement, vitamins and amino acids. All others are used for to increase the shelf life or for cosmetic purposes. So artificial sweeteners, that is natural sweeteners, sucrose is added. Example is sucrose. So natural sweetener is sucrose, but sucrose first of all increases the calorie intake, plus it can't be taken by people, that is it increases the blood glucose level or blood sugar level, therefore it cannot be ingested by people who are diabetic. So hence many people they prefer to use artificial sweeteners. Orthosulfobenzamide, which is also called as saccharin, is the first popular artificial sweetener or sweetening agent. It has been used as a sweetening agent since it was discovered in 1879. It's about 550 times more sweet than cane sugar, and it is excreted from the body in urine unchanged. It appears to be entirely inert and harmless when taken, and it is of great value to diabetic patients who need to and people who need to control their calorie intake. Other artificial sweeteners are aspartame, sucralose, and allitame, along with saccharin or orthosulfobenzamide. Now, aspartame is most successful and widely used. So, first used artificial sweetener since 1879 was saccharin or orthosulfobenzamide, but most successful and widely used artificial sweetener and 100 times more sweet, that was 550 times more sweet, saccharin. This is 100 times more sweet than cane sugar is aspartame, but aspartame is not stable in while at cooking temperature. That is, its use is limited to soft drinks and cold foods. It is methyl ester of dipeptide formed from aspartic acid and phenylalanine. What is aspartame? Aspartame is methyl ester of dipeptide formed from aspartic acid and phenylalanine. Methyl ester of dipeptide formed from aspartic acid and phenylalanine. Allitame is the most sweetest, that is high potency sweetener. Although it is more stable than aspartame, the control of sweetness in food is difficult while using it. It is 2000 times more sweet than cane sugar. Sucralose is trichloro-derivative of sucrose. Sucralose is trichloro-derivative of sucrose. Its appearance and taste are like sugar. It is stable at cooking temperature and it does not provide calories. Food preservative. Food preservative prevents spoilage of food due to prohibiting microbial growth. Most commonly used food preservative is table salt, sugar, vegetable oil, and sodium benzoate (C6H5COONA). Sodium benzoate is used in limited quantities and metabolized in the body. Salts of sorbic acid and propionic acid are also used as preservatives. So, what are the preservatives which are commonly used? Table salt, sugar, and vegetable oil, and sodium benzoate, that is C6H5COONA. Then sodium benzoate is used in limited quantities because it is metabolized in our body, and then other salts of propionic acid and sorbic acid are also used as preservative. Antioxidants of food, that is antioxidants are important and necessary food additives. How? That is, what do antioxidants do? Antioxidants help in food preservation. that is antioxidants basically help in food preservation. How? That is, they retard the action of oxygen on food. So basically food becomes bad, or does not stay preserved or fresh for a very long time because of oxidation by oxygen, that is action of oxygen on food. So antioxidants, they basically help in food preservation and increase the shelf life of food by retarding the action of oxygen on food. They act through several chemical mechanisms. The two most familiar antioxidants are butylated hydroxytoluene, that is BHT, and butylated hydroxyanisole. So antioxidants are the antioxidants help in food preservation. How? By retarding the action of oxygen on food. Antioxidants basically retard the action of oxygen on food, and they help in food preservation. They act through several chemical mechanisms, but two of the most familiar antioxidants are BHT and BHA. BHT is butylated hydroxytoluene, and BHA is butylated hydroxyanisole. The addition of butylated hydroxyanisole BHA to butter increases its shelf life from months to years. Sometimes BHT and BHA along with citric acid are added to produce more effect. Sulfur dioxide and sulfite are useful antioxidants for wine and beer, sugar syrup, and cut, peeled or dried fruits and vegetables. Okay, so antioxidants in food. That is, antioxidants are very important and necessary food additives. How? That is, antioxidants help in food preservation. They retard the action of oxygen on food, and they act through several chemical mechanisms. Two of the most familiar antioxidants are BHT and BHA, butylated hydroxytoluene and butylated hydroxyanisole. Butylated hydroxyanisole on butter increases the shelf life of butter from months to years. Similarly, BHT and BHA along with citric acid are added to produce more effect. So BHT and BHA, they are along with citric acid, they are, if they are put along with citric acid, then they produce more effect. Sulfur dioxide and sulfite, they are useful antioxidants for wine and beer, sugar syrup, and cut, peeled or dried fruits and vegetables. So sulfur dioxide and sulfite, they both are very useful antioxidants for wine and beer. So what are the important antioxidant? BHT, that is butylated hydroxytoluene, then BHA, butylated hydroxyanisole, then sulfur dioxide and sulfite. Sulfur dioxide and sulfite, they are useful antioxidants for wine, beer, sugar syrup, cut, peeled or dried fruits and vegetables. Now cleansing agent. Cleansing agent, that is, we are going to learn about detergents. Now there are two types of detergents are used in cleansing agent. First are soaps, and second is synthetic detergent. So what do soaps and synthetic detergent do? They improve the cleansing property of water. So basically, if there is a stain, we just put water, then lot of the times the stain will not go away. That is, it needs it needs an enhancement. That is, it needs an improvement. So what do soaps and synthetic detergents do? Synthetic detergents and soaps, they improve or enhance the cleansing property of water and help in the removal of fats which bind other materials to the fabric or skin. So the fats which bind to other materials to the fabric, which bind other materials to the fabric or skin, it helps in removal of them. So it helps in the removal of fats which binds other materials to fabric or skin. So see, this is the structure of glyceryl ester of stearic acid, that is fat. Glyceryl ester of stearic acid, fat, plus sodium hydroxide, it gives sodium stearate and glycerol or glycerin. So soaps are the detergents. So first we'll learn about soaps. What are soaps? Soaps are the detergents which are used since long. Soaps are used for cleaning purpose. Soaps used for cleaning purpose are sodium or potassium salts of long chain fatty acids. So the soaps which are used for cleaning purpose are sodium or potassium salts of long chain fatty acid. What are the examples? Stearic, oleic, palmitic acids. Soaps containing sodium salts are formed by heating fat, that is glycerol ester of fatty acid. So the soaps which contain sodium salts are formed by heating the fat, that is glycerol ester of fatty acid, with aqueous sodium hydroxide solution, and this reaction is known as saponification. So this reaction which was given above, this is saponification. This reaction is saponification. So glycerol ester of stearic acid, fat, plus sodium hydroxide gives sodium stearate and glycerol or glycerin. So this is saponification. So basically soaps are detergents which have been used since long, and they are used for, so the soaps which are used for cleaning purposes, they can be either sodium or potassium salts of long chain fatty acid. Sodium or potassium salt of long chain fatty acid, example stearic, oleic and palmitic acid. Now the soaps which contain sodium salts are formed by heating fat, that is glycerol ester of fatty acid, with aqueous sodium hydroxide solution, and this is called as saponification. Now in this reaction what happens? In this reaction esters of fatty acid are hydrolyzed. So basically this glycerol ester of fatty acid, this glycerol ester of fatty acid, this is hydrolyzed, and the soap obtained remains in colloidal form. Okay, so then we get the soap which is in the colloidal form, you know colloid, right? So it is precipitated from the solution by adding sodium chloride. So the soap is precipitated from the solution by adding sodium chloride NaCl, and the solution left after removing the soap contains glycerol, which can be recovered by fractional distillation. So the solution left after removing the soap it has glycerol. So this is the soap sodium stearate. The solution contains glycerol, and we can get this glycerol by fractional distillation. Only sodium and potassium soaps are soluble in water, and they are used for cleaning purposes. Generally, potassium soaps are soft to the skin than sodium soaps. Potassium soaps are soft to the skin than sodium soaps, and they can be prepared by using potassium hydroxide solution in the place of sodium hydroxide. So soaps have been used since time immemorial or since long, and they are used for so the soaps which are used for cleaning purpose are either sodium or potassium salts of long chain fatty acids, and they can be stearic, oleic and palmitic acid. So the soaps containing sodium salts, they are formed by heating fat, that is glycerol ester of fatty acid, with aqueous sodium hydroxide solution. So glycerol ester of fatty acid is heated with aqueous sodium hydroxide solution, and this reaction is called as saponification. The esters of fatty acid are hydrolyzed, and the soap obtained, it remains in colloidal form. Till when does it remain in colloidal form? That is, it remains in colloidal form till it is precipitated from the solution by the addition of sodium chloride, that is NaCl. Then after NaCl is added, then the soap, that is the soap sodium stearate, okay, this sodium salt of fatty acid, and which can be either stearic acid or palmitic acid or oleic acid. So long chain fatty acid, in this case this was glycerol ester of stearic acid, so we got sodium stearate. When this soap is removed, then the solution is left, then in that solution contains glycerol. And how do we obtain glycerol? We obtain glycerol by fractional distillation. Now only sodium and potassium soaps are soluble in water and can be used for cleaning purposes. Generally sodium soaps are softer than potassium soaps are softer than sodium soaps. Potassium soaps, the soaps which we get from potassium, they are softer than sodium soaps. And how do we prepare potassium soaps? That is, potassium soaps are prepared just like sodium soaps, that is by taking that is by using potassium hydroxide solution with glycerol ester of fatty acid in the place of sodium hydroxide. Types of soaps. Basically, all soaps are made by boiling fats or oils with suitable soluble hydroxide. So just like sodium and potassium salts of steric, oleic, or palmitic acid, which were made by heating the glycerol ester of fatty acid along with sodium hydroxide solution to obtain the sodium salt, or potassium hydroxide solution to obtain the potassium salt or soap. That is, similarly, all soaps are made by boiling fats or oils with suitable soluble hydroxide. Variations are made by using different raw materials. So toilet soaps are prepared by using better grades of fats and oils, and care is taken to remove excess alkali. Color and perfumes are added to make these more attractive. So toilet soaps are prepared by using better grade of fats and oils, and special care is taken to remove excess alkali, and colors and perfumes are added to make these more attractive. Soaps that float in water are made by beating tiny air bubbles before their hardening. So the soaps which float in water, they are made by beating tiny air bubbles before their hardening. So if you make small air bubbles before the soap hardens, then the soap becomes porous, and therefore
डाटा पळेल की मामा फोन करतल्या नंबर असले but they automatically the reboot button reboot कराल restart.
soaps that float in water are made by beating tiny air bubbles before their hardening. Transparent soaps are made by dissolving the soap in ethanol and then evaporating the excess solvent. So how do we make transparent soap? Transparent soaps are made by firstly dissolving the soap in ethanol and then evaporating the excess solvent. So if we dissolve the
फोटो नहीं कॉन्टैक्ट ये दुनिया सब जिनसे से कौन पढ़ेला बोली कौन
soaps that float in water Soaps that float in water are made by beating tiny air bubbles before their hardening. Then transparent soaps, they are made by dissolving the soap in ethanol and then evaporating the excess solvent. Medicated soaps, substances of medicinal value are added in some soaps. Deodorants are added. Shaving soaps contain glycerol to prevent rapid drying. A gum called rosin is added while making them. Then it forms sodium rosinate, which lathers very well. Laundry soaps contain fillers like rosinate, sodium silicate, borax, and sodium carbonate. Then soap chips are made by running a thin sheet of melted soap onto a cool cylinder and scraping off the soaps in small broken pieces. All of this is so important. There is no way, nothing, no escape. So sodium chips are made by running a thin sheet of melted soap onto a cool cylinder and scraping off the soaps in small broken pieces. Then soap granules are dried miniature soap bubbles. Soap powders and scouring soaps contain some soap, a scouring agent or abrasive such as powdered pumice or finely divided sand, and builders like sodium carbonate and trisodium phosphate. Builders make the soaps act more rapidly. The cleansing action of soap has been discovered in Unit 5. Okay. So this entire part is very, very important. It has to be remembered. Okay, so soaps which float in water are made by beating tiny air bubbles into it. Soaps which float in water are made by beating tiny air bubbles into it. Then transparent soaps are made by dissolving that soap in ethanol and evaporating the excess solvent. Okay, let's start from here only. Types of soaps. So basically all the soaps are made by boiling fats and oils with suitable soluble hydroxides, and variations are used by making different use of different raw materials. Firstly, toilet soaps are prepared by using better grade of fats and oils. Toilet soaps are prepared by using better grade of fats and oils, and care is taken to remove the excess alkali. Color and perfumes are added to make it more attractive. Then soaps which float in water are made by beating tiny air bubbles into it, therefore they float in water. Transparent soaps are made by dissolving the soap in ethanol before and evaporating the excess solvent. Then medicated soaps, substances of medicinal value are added in some soaps. Are added. Then in some soaps, deodorants are added for smell and fragrance and all. Then shaving soaps, they contain glycerol. Why? To prevent rapid drying. So to prevent rapid drying, the shaving soaps, they have glycerol in it, and a gum called rosin is added while making them. A gum which is called as rosin is added while making them, and it forms sodium rosinate, which lathers well. Then laundry soaps contain fillers like sodium rosinate, sodium silicate, borax, and sodium carbonate. Then sodium chips are made by running a thin sheet of melted soap onto a cool cylinder. Sodium chips, they are made by running a thin sheet of melted soap onto a cool cylinder and then scraping off the soaps in small broken pieces to make soap chips. Then soap granules are dried miniature soap bubbles. Soap powders and scouring soaps contain some soap, a scouring agent or abrasive such as powdered pumice or finely divided sand. And builders like sodium carbonate and trisodium phosphate. Builders make the soap act more rapidly. So to make the soap act more rapidly, builders are used. What are the builders? Sodium carbonate and trisodium phosphate. Now, why do soaps not work on hard water? What is hard water? Hard water is water which contains calcium and magnesium salts basically. And these ions are form insoluble calcium and magnesium soaps respectively when sodium or potassium soaps are dissolved in hard water. So when sodium or potassium soaps are dissolved in hard water, then they form insoluble calcium and magnesium soaps respectively. So if this is a sodium soap plus CaCl2 gives NaCl plus insoluble calcium soap. So these insoluble soaps separate as scum in water and they are useless as cleansing agent. In fact, they are hindrance to good washing because the precipitate adheres onto the fabric of the cloth as gummy mass, and hair washed with hard water looks dull. Why? Because of this sticky precipitate. So therefore, if we wash our hair with hard water, then our hard water is going to look dull because of this sticky precipitate, and this insoluble calcium stearate soap, that is, it is basically scum in water and it is basically useless, and it is a hindrance to good washing because this scum, it precipitates or adheres onto the fiber of the cloth as gummy mass. Then dye does not absorb evenly on cloth washed with soap using hard water because of this gummy mass. Then synthetic detergents are cleansing agent which have all the properties of soaps but which actually do not contain any soap. So this is funny, right? Good line. Synthetic detergents are cleansing agents. So synthetic detergents are cleansing agent. They have all the properties of soap, but they do not actually contain any soap. So they can be used in both soft and hard water, and they give foam even in hard water. So synthetic detergents are basically have all the properties that a soap has, but they are not soap. They do not contain any soap, and they can be used in soft as well as hard water. In fact, they give foam even in hard water. Now, some of the detergents give foam even in ice cold water. Forget about hard water and soft water, even in ice cold water they can give foam. Synthetic detergents are mainly classified into three categories. First is ionic detergent, second is cationic detergent, and third is non-ionic detergent. Anionic detergent, cationic detergent, and non-ionic detergent. So firstly, anionic detergents. Anion name suggests negatively charged. So anionic detergents are sodium salts of sulfonated long chain alcohols or hydrocarbon. So anionic detergent are sodium salts of sulfonated long chain alcohols or hydrocarbons, not fatty acids, fats and all those things. This is long chain of alcohol or hydrocarbon, and alkaline hydrogen sulfates formed by treating long chain alcohol with concentrated sulfuric acid are neutralized with alkali to form anionic detergent. Basically, anionic detergent are nothing but sodium salts of sulfonated long chain alcohol or hydrocarbons. So, in the case of soaps, we used to take glycerol ester of fatty acid, long chains, and then we used to react it with metal hydroxides. In this case, we are going to, and then we used to get sodium stearate, that is a sodium and potassium salt of stearic acid, in stearic acid or oleic acid or palmitic acid. Whereas in this case, it is going to be in anionic detergent, that is in detergent, they are going to be, all the properties are going to be same, but soap is not going to be there, that is fat and vegetable oil, all those things are not going to be there. So basically sodium anionic detergent are nothing but sodium salts of sulfonated long chain alcohol or hydrocarbon, and alkyl hydrogen sulfates are formed by treating long chain alcohols with concentrated sulfuric acid. So alkyl hydrogen sulfates are formed by treating long chain alcohol with concentrated sulfuric acid, and then they are neutralized with alkali to form anionic detergent. So see, here we took L'Oreal alcohol, which is a very long chain alcohol, then we put sulfuric acid in it, and then we got hydrogen sulfate. This hydrogen sulfate is then acted with an alkali, sodium hydroxide, to get an ionic detergent, sodium L'Oreal sulfate, which gives very good lather, and it is present in all the shampoos that we use. If you read the ingredient section, then you will find sodium lauryl sulfate. So similarly, alkyl benzene sulfonates are obtained by neutralizing alkyl benzene sulfonic acid with alkali. So in a similar way, your alkyl benzene sulfonates, they are obtained, by neutralizing alkyl benzene sulfonic acid with alkali. So here we took so here we are going to take dodecyl benzene. We are going to put sulfuric acid, then we are going to get dodecyl benzene sulfonic acid. Then we are going to treat it with alkali, and we are going to get sodium dodecyl benzene sulfonate. In anionic detergent, the anionic part of the molecule is involved in the cleansing action. Sodium salts of alkyl benzene sulfonates are an important class of anionic detergent. They are mostly used for household work. Anionic detergent are also used in toothpaste and household work. Basically, anionic, remember, sodium will be there will be a long chain alcohol or hydrocarbon which would be reacted by first sulfuric acid, then with an alkali, sodium hydroxide, and then we will and then the positive metal part and negative part will be there, and that anionic part, this entire part, it's going to play a very important role in household work and detergent and in toothpaste and all. Cationic detergent are quaternary ammonium salts of amines with acetate, chloride and bromide as anions. Cationic part possesses a long hydrocarbon chain and positive charge on nitrogen atom, hence these are cationic detergents. So cationic detergents are quaternary ammonium salts of amines with acetate, chloride or bromide as anions. Okay, so they are cationic detergents are quaternary ammonium salts. Okay, quaternary ammonium salts, that is RR, okay, 4 quaternary ammonium salts. Single is primary, 2 secondary, tertiary, quaternary. Quaternary ammonium salts of amines with acetate, chloride and bromide. Acetate, chloride and bromide as anions. Either CH3CO CO minus, that is acetate HCO acetate, or chloride Cl or bromide Br minus. Cationic part possesses a long hydrocarbon chain and a positive charge on the nitrogen atom, hence these are called as cationic detergents. So over here, as you can see over there, the anionic part was working as a cleansing agent detergent. Here the cationic part containing the quaternary ammonium salt of amine, that is the long hydrocarbon chain with positive charge, that is the basically is involved in the cleansing action, and therefore these are called as cationic detergent. Example is cetyl trimethyl ammonium bromide. Cetyl trimethyl ammonium bromide is a popular cationic detergent and it is used in hair conditioners. This is very important. Cationic detergent have germicidal properties and they are expensive, therefore they are of limited use. So they have germicidal, that is they can kill germs, so therefore they are expensive and they are of limited use. Then non-ionic detergent do not contain any iron in their constitution. One such detergent is formed when stearic acid reacts with polyethylene glycol. So non-ionic detergent do not contain any iron in their constitution. Non-ionic detergents, they don't contain any iron in their constitution. One such detergent is formed when stearic acid reacts with polyethylene glycol. Stearic acid reacts with polyethylene glycol to give this. Liquid dishwashing detergent are of non-ionic type, so no cation, no anion, plus minus उसमें होता ही नहीं है. Mechanism of cleansing action of this type of detergent is same as that of soaps. These are also remove grease and oil by micelle formation. So liquid dishwashing detergents are of non-ionic type first off. Then mechanism of cleansing action of this type of detergent is same as that of soaps. Okay. They also remove grease and oil by micelle formation. Main problem that appears in the use of detergent is that their hydrocarbon chain is highly branched, then bacteria cannot degrade this easily. What is the main problem which appears in the use of detergent? That is, the hydrocarbon is highly branched and therefore the bacteria cannot degrade this easily. Slow degradation of detergent leads to their accumulation. Effluents containing such detergent reach the river and pond, and these persist in water even after sewage treatment and cause foaming in rivers, pond, stream, and water gets polluted. These days, the branching of hydrocarbon chain is controlled and kept to minimum. Unbranched chains can be biodegraded more easily, and hence pollution can be prevented. So the main problem with detergent is that since detergent have first of all very long chain hydrocarbons, and these long chain hydrocarbons are profusely branched, and since they are so much branched, the bacteria can't degrade it. So therefore they, even after sewage treatment, wastewater treatment, still some of them remain and they basically foam, and we can see them in rivers and ponds, that is foaming in rivers and ponds and streams, and therefore ultimately the water gets polluted. Hence nowadays the branching is controlled and kept to minimum, and unbranched chain can be biodegraded more easily and pollution can be prevented. Write the chemical equation for preparing sodium soap from glycer. Okay, thank you.